So, good evening, everyone. My name is Demetria Sloan. I'm the Alumni Leadership Giving Officer, and welcome to tonight's Alumni Thought Leadership panel on Black men's health. We are super excited to have you and look forward to an engaging conversation and engaging dialogue. For housekeeping purposes, we ask that you are on mute. Unless you want to come off mute, you can certainly use the functions where you raise your hand if you want to ask a question. We have a list of prepared questions. Our moderator is going to engage our guests in a very robust dialogue about health and the vast spectrum of Black men's health. However, there might be some specific questions that come about that you want to raise. We ask and encourage you to put them in the chat. If you want to come off mute and ask a question specifically, feel free to do that as well. And I'm just going to be tossing it over to our good friend who's going to serve as the moderator, Dr. Trevon Thompson. But also on the line, we have Dr. Marcio Pico, who is our Director of Alumni Relations on the call as well. And she and I will be monitoring the chat and behind the scenes. We highly encourage you to forward this invite to 5 of your friends and say, hey, you need to be on this conversation, because I know each and every one of you probably knows someone who should be here and a part of this conversation and discussion tonight. And so without further ado, Dr. Thompson, I'm going to pass it off to you.
Thank you so much, Demetria, and thank you to Xavier for putting on this Alumni Thought Leadership series. I think this is wonderful for us to leverage the expertise that we have amongst ourselves as Xavierites. And I think it's important that we recognize this is Men's Health Month, and so we want to take some time to specifically address issues related to Black men's health. So with that, we have a wonderful panel of alumni here with us to serve as our experts for this discussion. I'll just mention them very briefly. Their bios are available in the announcements that went out. If we spent time going over everyone's bio, we'd be here probably an hour just to get through our bios, because as you all know, Xavierites don't do the least, we do the most, and the bios of our distinguished guests here today are quite extensive. So as Demetria said, I am Trevon Thompson. I'm an emergency physician and medical toxicologist in the Chicagoland area, also the Dean for Admissions for the University of Illinois College of Medicine, and I serve as a director for the board for the new Xavier Ochsner College of Medicine that we are looking very much forward to. I'm a member of the class of 1997. And so very briefly, I'll just introduce the rest of the panel. We have Dr. Byron McGee with us here of the class of 1998, who is a gastroenterologist. We have also with us Dr. Victor Njoku, who is a member of the class of 2004, a vascular surgeon, and also Dr. Byron Young, the class of 2006, who is a child, adolescent, and adult psychiatrist. Again, when I say we do the most, we do the most. We don't just have a couple of board certifications. I think everyone here is multiple board certified. So this is a wonderfully distinguished panel here. So with that, let's just hop right into the topic of the day and maybe set the stage just a little bit. And maybe we'll go around and maybe we'll do this first question in order of your graduation year from Xavier. So we'll go with Dr. McGee, Dr. Njoku, and then Dr. Young. And that first question is in the vein of setting the stage, what do you see as the most urgent health challenges facing Black men today? Dr. McGee.
Dr. Thompson, thank you. Thank you for that wonderful introduction. And thank you, Xavier, for allowing us this platform. Me personally, I think health literacy, that is going to be my lead off for what I think is most important, because you don't know what you need to know until you need to know it. And I think that we have so many different things. I mean, I can speak from prevention in my field and the things that we try to let people know as far as when to have certain types of screenings, when to have testing done. Health literacy will cover so many different things. And I think that the way that this has worked out is the way it's supposed to. By increasing the numbers of people that look like us in the field of medicine, we're able to bring things back to our own respective communities for people that may look to people that look like us want to trust their healthcare, and they feel comfortable, they can ask questions, and they get the information that they need. So that would be my answer.
Thank you so much for that. Now, Dr. Njoku, what do you think?
Yes, thank you, Dr. Thompson and Xavier, for inviting me to this. I'm deeply honored to be on this panel. Yeah, to kind of lead where Dr. McGee was going, I think that a big focus on health, wellness, diet, just a lot of prevention and education surrounding that is vital for the longevity of our Black men and just society as a whole. As a vascular surgeon, you see so many chronic diseases that could ultimately could be preventable just through lifestyle modifications. So, uh, but that would be my take on things.
Thank you. And Dr. Young.
Yeah, thanks so much. Yeah, I really appreciate the answers that both gentlemen gave, and agree completely. I think just kind of a global access to care barrier, right? There's so many nuanced reasons why access to care is an issue, and so whether you talk about the stigma that exists around just healthcare, which is because I feel like when people talk about stigma, they talk about it as though it's like the patient's fault, but the stigma, particularly for African Americans, is rooted in a history of lots and lots of racism and dehumanization at the hands of all American systems, but particularly the medical system and the mental health care systems that I navigate. And so I think this like notion of like, and there's still data coming out now in terms of Black patients being treated with less empathy, less time, less, So I think those are things like if you're going to a space and the space doesn't make you feel whole or recognize your humanity, you're less likely to engage in that space. I think there's some data that supports that Black folks struggle with money and kind of access to care in terms of like uninsured or underinsured or particularly just like kind of ideas around maybe what not knowing fully what's covered and what's not covered, so not wanting to like even risk incurring bills that might add up in that way. So I think there are lots of things that kind of get in the way in that regard. And I think and this goes along with the kind of medical literacy. I think just a lack of sometimes I think we have this thing where we got it. We just kind of feel comfortable trusting our gut and trusting our own solutions. And, we feel like everything's fine. And sometimes have kind of a defensiveness around the notion that sometimes you need to ask for help. And I think, that's a thing, that's a general thing for all people, particularly men, but also Black men, where sometimes we don't feel comfortable or feel worthy or feel like asking for help is the appropriate thing to do. So I think that plays a little bit of a role in it too. Just hearing, from my friends and my loved ones too. So I think those are major barriers as well, for sure.
Thank you. And I don't see any questions from the audience just yet. So audience, feel free to drop a question in the chat if you have one. But Dr. Young, you mentioned stigma, so you sort of brought that up. And I think if we can explore that just a little bit more, in terms in particular mental health, but certainly there's stigma in other areas of health as well. And sometimes just going to see the doctor can carry some stigma. But if we talk specifically for a moment about mental health, how do we change within our community some of that stigma around mental health? What does care look like for the Black male who might have that stigma of, I think many of us understand this. I'm just going to tough it out. If there's a problem, I'm just going to put my nose to the ground. I'm just going to keep grinding it out. And while that is that perseverance, that resiliency is good, but we are grinding ourselves into an early grave in many cases. So how do we work through that idea of stigma as it relates to mental health?
Yeah, I think because the stigma is so kind of multifaceted, that's a big question. But I will say, in some ways, I think I'm from New Orleans, and it's funny. I grew up kind of as a nerd, so I don't really speak the kind of with the New Orleans accent, but I can turn it on for fun. So I know my family be like, I ain't crazy, no, cause I ain't crazy, So that's kind of folks are like, yeah, I think just folks connect mental health services with being crazy or being like less than. And so I think that's a big thing that we have to like. Everyone has mental health, right? Mental health is this thing that we all have, and we all have to take care of. And so I give the analogy of like when you want to work on your physical health, you eat well and you exercise and that kind of thing. So you like might go to the gym, and when you go to the gym, you go consistently. There's never a time where you're not checking on your physical health to like. It's never like, oh, I went to the gym enough, I'm done, right? And so I feel the same way. I feel the same way about therapy. I also feel the same way about just making sure that you're checking in on your mental health in general. And as Black folks, if anyone has reasons to check in on the mental health, it's us. Like we've been through a lot, and we have resilience and an anti-fragility, meaning the notion of I think sometimes we are made even stronger when we kind of come against lots of things that we've come against, like we've come out of it. But it always has some consequences to the trauma always has consequences. And so even if you're doing great, even if you're thriving, you still need to take it seriously that you may have some stuff to work on. And we all have stuff to work on. As a psychiatrist, I talk about defenses, and we all have defenses. We all have blind spots. So even the most self-aware kind of person who kind of feels like they really know themselves, or they like talk to their friends or whatever, there's just a level that of depth that you get when you engage with therapy, particularly to kind of see the spaces where you might need work and you don't even know you need work, right? I say the difference between just surviving and thriving, right? We want to thrive, we don't just want to survive. And so I think we owe that to each other. And I think the onus is on us as men in our text threads and our groups and our friendship groups, whether, fraternities and folks we play basketball with or whatever. We should be talking about these things. We should talk about the importance of these things. Checking in, how you doing, brother? You all right? And really like, no, really, how you doing? So like asking and making it like a safe space to even talk about emotional wellness, to talk about emotions and feelings and that kind of thing. I think we just have a lot of work to do. Sometimes I feel like there's this need in America, but particularly for Black men, to be like this hyper masculine, and so being tough and not owning that we need help sometimes is a thing that gets in the way. So I think, yeah, for us, I think some of it just looks like checking in, and maybe if you I know I talk about having a therapist all the time to try to normalize it and talk about how I didn't go because I felt like I was crazy. I just wanted to kind of understand myself better and kind of see my blind spots better. So I think there's some ways that we could kind of better engage with it.
Thank you for that. And that question was geared more specifically towards mental health and stigma. But Dr. McGee, as a gastroenterologist, there's got to be some stigma that's playing a role in how or why people might come see you. I'll just throw out an example. When Chadwick Boseman passed away from colorectal cancer at a very young age, that was, I think, a pivotal moment for many, particularly Black men who maybe thought, I'm not at risk for colon cancer. My family, I don't have a family member that has it. I'm not old. I don't need a colonoscopy. Maybe could you describe maybe where stigma comes in your field?
Yeah, the stigma comes in a lot because of the procedure itself. If we talk about the technical part of the procedure, people will be quick to say, "Oh, you're not putting that there." And so there's this stigma and fear of what the procedure would entail, whether or not there's pain involved with having the procedure, discomfort, things like that. And so what I appreciate is if I can get the patient in the room, I feel like I have a great chance of getting them to actually follow through with the plan of care. Because when the provider and the patient can talk about what needs to happen, what's going to happen, what we're doing, the importance of what we're doing, and what the different outcomes could be. I think it makes them more inclined to want to actually follow through with everything. If you just go in there and you talk to a patient and say, "Hey, you need this and you're going to have it and this is what it is," you're not going to get a lot of people. I mean, people want to be spoken with, not talked to. And so there's so much communication that I think that in general, as providers, if we come in with the right form of communication, I think it helps us to attract so many different types of patients. But the stigma of what a colonoscopy involves and what we're trying to do, I love dispelling that stigma in any way I can. And they can ask any question that's not uncomfortable. I can bring some humor into it, or I can keep it scientific if I need to. I just know how to read the room.
Thank you for that. And Dr. Njoku, there may be those in the audience here who may be less familiar with a vascular surgeon. I think people know what a cardiologist is. They may know what a CT surgeon is, a cardiothoracic surgeon. They may be a
Right.
little less familiar with what you do. Maybe could you describe a little bit about what you do, and then perhaps some of the stigmas related to care that you might see?
Yes, yeah, absolutely. So, yeah, anytime, say they say, "Oh, what do you do for a living?" I say, "Oh, I'm in medicine." Or they say, "Oh, what type of medicine?" And then I'll say, "Oh, I'm a vascular surgeon." Everybody's eyes like open wide. I don't care who you are because there's like either it's because they don't want to come see me and they know what I do, or two because they're like, "Oh, wow, it seems like this big mythical figure that." I just tell people it's just glorified plumbing, right? It's just smaller pipes, and it's basically every blood vessel in the body, both arteries and veins, that we treat, except for the brain and the heart. And essentially, anything that you can think that go wrong with the pipes in your house can go wrong in the pipes in your body, right? As far as blood vessels are concerned. And so one of the reasons I went into it is just because I like the fact that you operate all over the body, right? And so there are emergencies. Like this weekend, I had a few gunshot wounds that I had to deal with and manage. But today, I had a few dialysis patients that I created accesses for. And then sometimes the biggest thing that affects our community a lot, right, is peripheral arterial disease, which I'm here in the Atlanta area, which is a big thing here in the South. And that's one of my passions within vascular surgery is saving limbs. And so just doing all that we can to try and save as many people from having to go undergo primary amputation as possible.
Great, thank you for that. I think that was
But Dr. Thompson, I just wanted to say, Dr. Njoku is a plumber like me. I mean,
There you
that's awesome that he considers that. That is just wonderful.
that is wonderful. Yes, yes. And so we have our first question in the chat, and I think this is probably more geared toward Dr. Young, but I think all of us could chime in a little bit on this. And the question is, can working on your physical health or doing some self-care replace going to a therapist? And I think this is a great question because I might start framing an answer as we bring this up to the table a little bit. I do think for sure, and Dr. Young may join in here, physical health can absolutely impact your mental health. However, I might argue, and I would love to hear your opinion, Dr. Young, that just like working on your physical health doesn't replace going to see your primary care physician, working on your physical health might not completely replace going to see a therapist or addressing your mental health in much more focused ways. So, Dr. Young, what do you think about that question?
Yeah, that's a good question. I just did a talk recently at Boston Children's through their Harvard Med program titled Black Love as a Template for Healing. And in that talk, I kind of made the case that like Black love is this kind of antidote to white supremacy. It's this antidote to anti-Blackness and an antidote to kind of the dehumanization in general that like is the kind of root of why we see so much of these disparities in medicine for all groups, not just Black folks, but folks in the LGBTQ community, women, and marginalized folks across the board, Latinx and otherwise. And in the talk, I talked about how connecting with kind of Afrocentric ways of being, whether from the continent or from the diaspora. And one of those threads I think that's really important from our ancestors is this thread of holism. So this notion of mind, body, and spirit connection. I think medicine has really gotten very like myopic, and so like it's like symptoms and I focus on the symptoms and not the kind of whole person. And so I think, yeah, holism is the way to go. I think mind, body, and spirit all need to be in line, and we need to be working on all those things in order to kind of achieve our best health. And so while I do think it's super important to take care of your physical health, and that does definitely affect your mental health, when you're talking about exercise, you're talking about getting endorphins, you're talking about just like protecting yourself from the maladies that can lead to mental health. So like, if you have lots of maladies will cause increased chances of mental health issues. So even heart attack, strokes, and all that stuff increase the chances of you having some of those mental health conditions. So I think that's important for sure. But it doesn't replace it because you need to do it all, you know. So you need to focus on the physical health. You know, the yoga and the meditation and those things are all really important. Yoga being more physical, meditation being more kind of mental. Like those things kind of go hand in hand in the same way with physical and mental medicine. So yeah, while it's not a replacement, it is a part, an adjunct, right? A part of a holistic way of taking care of yourself. And yeah, you should have like a thorough regimen of all those things. So having your physical health routine, as well as your therapist, as well as your counselor, as well as your, you know, the people that you're checking in on your mental health with.
Thank you for that. And thank you for asking that question. I mentioned before, I'm an emergency physician, and one thing that comes up regularly, I'm going to see a patient talking about their ankle pain, their stomach pain, their laceration, whatever it may be. And then lo and behold, their blood pressure is markedly elevated. And I might say to a patient, did you know you have high blood pressure? I don't have high blood pressure. What are you talking about? Well, no, sir, clearly you have high blood pressure. And so, you know, that's sort of a silent threat, if you will, something that the patient did not know that they had until they came to see me for something completely unrelated. And then, unfortunately, there are times when the presentation of that first presentation of high blood pressure might be the heart attack, the kidney disease, the stroke, that sort of thing. So maybe from each of your perspectives, and maybe we'll start again with you, Dr. McGee, what are some of the silent threats? Maybe something folks aren't getting screened for appropriately, or maybe something that folks are ignoring until it's too late, and then they show up to see you.
Yeah. So I'm also board certified in internal medicine, and I worked as a hospitalist before I went back to do my GI fellowship training. So I still wear that hat when I see patients. Um, I've diagnosed, I don't know how many thyroid disorders just from doing a routine blood panel when a patient is seeing me for things like constipation or diarrhea. There are plenty of times that I will see blood pressures and I'm counseling about blood pressures. We're seeing the elevated serum creatinine, and I'm like, hey, your A1C is like in the double digits. Has anyone ever told you the importance of getting this thing down? But the biggest thing for me is when I have a female patient that comes in and she's got abdominal pain. Well, after I'm running through the things that I specialize in, you know, one of my questions is, hey, you know, do you have a gynecologist? And when's the last time you've seen your gynecologist? And so many times, more than half times, you have someone who may even be of childbearing age that hasn't seen one or in more than 3 years, which is not really, you know, I don't keep up with all of their guidelines, but I'm sure that's a little too long to go between seeing your provider. So there are plenty of times that I've been able to get people to a gynecologist, and that was probably the root of their stomach pain. So I just encourage not to have tunnel vision when you're seeing patients. I understand you may not be able to take care of every complaint, especially, you know, you're a vascular surgeon. You need to be focused on certain things, but there are certain times where you just have to take that extra minute to provide a little bit of care.
Thank you for that, Dr. McGee. And Dr. Njoku, some of the silent threats in your area.
Yeah, absolutely. So, you know, just like Dr. McGee, I went through general surgery training, and you know, I'm in private practice, and one of the nice things about private practice, there's not necessarily anyone telling me I have to do something in a certain time frame, right? And so I have my specialty, unfortunately, has a lot of patients that will inevitably either have coronary artery disease, right, diabetes mellitus, hypertension, and so uh, is long smokers, right? So I will inevitably always take the time to help patients understand how all those different comorbidities fit into why they're coming to see me that for that particular visit, right? And it and patients and you know, I kind of cover the south side of Atlanta, and you know, so much goes into, right, this kind of socioeconomic determinants of health, right? And literally in Atlanta, you can draw a line below I-20 and show how individuals don't live as long as people above I-20. And the only difference is that is more Black and brown folks below I-20, and also less access to healthcare, like Dr. Young was speaking about. And so, just trying to do my part to make sure that patients in that area are aware of why, hey, I just hit my toe and it's been a month, why it's not been healing, right? Or hey, I'm having a I can't breathe because I need a dialysis catheter. And, I had uncontrolled hypertension for the last several years, right? Or I've been smoking and I say, you got to quit smoking, or I cut back to 3 cigarettes right. And how that all, all plays a role. And just trying to make sure people understand that that's why that's the case.
Thank you. And Dr. Young, I would imagine in your field, you're probably dealing with the most silent of the silent maladies, right? Because often you can't necessarily see mental health, right? There's no physical, your arm doesn't look broken kind of thing with mental health. And then people try to hide it when it is present. And then we just talked about stigma. So maybe what are those sort of those areas in your field where those silent threats might exist?
Yeah, I think you hit the nail on the head. I think you could almost tie most any mental health condition. I mean, sometimes you can't, like really bad personality disorder or maybe psychosis or something like that, or like mania would be hard to hide. But depression, anxiety, and even slight psychosis you probably could hide pretty well. And personality disorders usually take getting to know people for a longer time, maybe before you can see those things. So yeah, I think people hide them often and hide them well. But the sad thing isn't even just hiding them from the outside world, but hiding them from themselves. I know so many folks live in a stew of anxiety and kind of think like that's just the way it's supposed to be. Like folks just think I'm supposed to go to bed every night worrying and thinking that things will just, ruminating on things of the day and thinking about things that can go wrong. I think sometimes it's just like people think that's normal, like that's just how it's supposed to be. Like you're supposed to be worried often. Or this notion of getting sad and kind of trying to just tough through it and kind of telling yourself that like, oh, it's fine, it's nothing's wrong, and just kind of being quite defensive about it. I just think we see that so often. And sometimes people have a very functional kind of, they call it functional depression, where you still get up and go to work, but that's about all you do. And so I think we see a lot of those things quite frequently. I think there's a lot of sadness that exists and a lot of worry that exists in our community and communities in general. I think some of this stuff is living in a kind of capitalistic white supremacist system makes it hard. It's hard out here, as they say. So it makes it hard sometimes to find your joy. I think even just thinking about there are so many, thinking about even folks, went to Xavier, very high achieving, smart folks sometimes get caught up in the notion of I'll be happy when, like I'll be happy when I achieve this thing or when I get this house or when I get this degree or when I get this whatever, and never really connect with the joy of being present and being kind of, spiritually connected and kind of connected with the internal joy. And so, yeah, I think it's really, sometimes it's some of the most highest achieving folks are some of the folks who are maybe the most miserable, the most lacking. I think even things, and this isn't like so much a mental health condition, but definitely involving mental health, like self-esteem and insecurity. There's so many of these things that are like silent things that people aren't even aware of themselves, that they don't even want to look at themselves. Sometimes it hurts to look inside. And I think if you can't look inside, that's almost a marker like, oh, something's going on that you need to really get some help to support. We see, extraordinarily defensiveness and extraordinary, you can't hold accountability to say like what say the role that you played in the thing. Like if those are things that you're struggling with, those things will get in the way of your relationships, of your job, but also your relationship with yourself. And so I think yeah, I think our field is full of the silent ones. So yeah, it's a lot.
Thank you. There's a lot to unpack here. And that maybe leads us into one of the questions that's in the chat right now. And the question starts off really simply that, I'm sure, at various ages and times of life, there are sort of checkpoints that you may want to engage with. And while I think we can spend some time on that, like when you should get your PSA or when you should get your colonoscopy and that sort of thing, if I can take a little bit of liberty with the question, I think the second part of this question might be even more valuable than that first point. And that is, and this is the question asker is getting a little personal here, but I appreciate it. But I have had to push harder to have some checkpoints such as colonoscopy and PSA checks as a black man done when it seems we are subject to maladies earlier than other populations. So this leads me to sort of think about this idea of how do we advocate for ourselves? It seems like there certainly are barriers even if we have access to care, that we may be getting different care. For those who aren't aware, we finally have gotten rid of the idea that the GFR, which is a measure of your kidney function, is different based on race. It is not. But we were treating as the house of medicine, so to speak, we were treating it very differently, which resulted in Black patients getting treatment for renal disease much later than they should have, resulting in more people going into renal failure, more people going into dialysis, and so forth. And so when we hear a question like, I had to push harder to get something, what are your thoughts on this self-advocacy in a system that it sometimes seems like there are just so many obstructions to us getting care? And I'll throw that out there for whoever wants to tackle that part first.
That's very loaded. I One of my biggest beefs, I guess, right now is how much I have to fight with insurance carriers, insurance providers. So it may not be the practitioner, maybe there are some barriers with your insurance carrier to getting something done. But then if you do feel that you have a provider that is not caring for you the way that you feel you need to, I would say get another opinion. Not so much a second opinion, another opinion, because sometimes you got to go past the second opinion to find the right fit. And it may not be that you have to specifically have to have a Black provider. I mean, that's not always the case. Um, you need a provider that is competent and probably updated on how medicine is provided nowadays. That would be hugely helpful. But just find someone that communicates with you the way that you feel you need to be communicated with. And you are your biggest advocate. Do not ever turn that role over to anyone. You are your biggest advocate. Speak up the way you feel comfortable speaking up. I never have a problem if a patient has a question or says they don't agree with something. I have no ego about it, and I'm more than happy to explain my point of view, where I'm coming from, the literature that I've engorged to help me formulate my opinion. Because you're only as good as the care as the care that you provide. That's my opinion.
Thank you. Other thoughts?
Yeah, I definitely see that in my world for vascular surgery. Just for example, when I first came out of fellowship, um, I was practicing at a facility that there were a lot of older vascular surgeons. Somewhat 20 years my senior, and um, and with our patient population, we had, I mean, we were doing so many amputations. I mean, it was insane. And a lot of those patients were, were your diabetes and renal disease. And a lot of our literature said that if a patient presented with a wound and had those two diagnoses attached to it, that you shouldn't even try, essentially. And essentially those surgeons, if they could not do an open bypass, they were just offering amputations to these patients, which has so many um, just issues that down the road lead for patients, right? From a morbidity, mortality standpoint, their ability to care for themselves, and the strain on their, loved ones. And I went out and got extra training actually, because I just felt that there had to be another way to potentially, save more of these limbs. And just come to find out that there was technology out there that addressed those needs, because a lot of those patients have really calcified arteries, which makes it hard to do a bypass. But you have other types of tools out there that allow you to open up those blood vessels. And so I have several patients that I've been able to help that were just told, there's nothing to do. I need to cut your leg off, and they have their leg today, right? And so, if it were not for those patients that seeking a second opinion, third or fourth opinion, and being their own advocate, like Dr. McGee was speaking about, that they could be down a different trajectory in their health. So.
Thank you for that. It's and Dr. Young, I'll give you a chance to chime in here as well. It's very interesting that you said that, and this will lean into something Dr. McGee said as well. I recently had a patient who showed up to my emergency department about 2 o'clock in the morning. He signed himself out against medical advice from another hospital where he was told he needed to have his leg amputated. Now, in his case, he did. He did, in fact. That was probably the right course of action. He was beyond,
Sure.
I think, being able to salvage the leg. But he felt so uncomfortable with the way the doctors were interacting with him that he didn't feel like he could be in that place and really wanted a second opinion, not because he thought that the leg was going to be saved, but he wanted to be somewhere he was more comfortable. So I think, both of you, even from very different specialties, are really hitting on that notion of finding folks who you can talk to, who you're comfortable with, and then ultimately who you can trust. Because I do think no matter what recommendations might be out there, whatever guidelines are out there, if you don't trust the person you're talking to, you're less likely to kind of follow along with what those recommendations are going to be. And that can ultimately have an adverse effect on your health. But at the same time, you do, I think, have to be comfortable with the person who's providing that care for you. So I think you're hitting on some really good points there. Dr. Young.
Yeah, I think this is something I'm quite passionate about, so I have a bit to say. I think that it's not, it is very data driven, the disparities in medicine that Black folks face in every field of medicine. I think some of the more popular ones are thinking about a Black woman being 3 or 4 times more likely to die around childbirth, despite education, despite class, despite, when you control for all those factors. In psychiatry, patients who have mood disorders with psychosis being much more likely to be diagnosed with a primary psychotic disorder like schizophrenia, which, those are two very different trajectories, two very different medication regimens. But oftentimes, if you don't take the time to sit down and really tease out the timeline, to tease out the symptoms, you just kind of rush through it. Or you have these preconceived notions, you'll get that kind of thing. There's a really kind of scary study that came out in 2016 that looked at it asked a bunch of med trainees, so med students, residents, and fellows, primarily at the University of Virginia, about these like stereotypes about Black people and Black patients. Some of the stereotypes were like they have thicker skin, they are less tolerant, they are more tolerant to pain because their nerve receptors are somehow less sensitive. Just all these really bizarre stereotypes. And 50% of those medical practitioners thought at least one of those wild, in my opinion, crazy stereotypes were true. And this is the doctors, this is, progressive scientists. And so if those folks, yeah, it just some scary stuff. And it's interesting because there are multiple studies that looked at this, and all the studies had the thing about Black people being less sensitive to pain, which I just think, but comes from slavery, comes from dehumanization and that kind of thing. And so yeah, so we see it across the board. And so the notion, there's data to support that, Black and brown physicians are much more likely to take good care of Black and brown patients, because I think when you're talking about Black folks, you're a little closer to that Black love I mentioned. So you kind of work through the stew of anti Blackness that we all are surrounded. We all swim in it. You can be Black, and be anti-Black too. But I think we're more likely to work through those things. Someone was talking about how skin folk and always kinfolk. One of the doctors who is on one of these Married to Medicine or something said something that was really kind of like gross about Black women patients being more like combative or more like argumentative or fussy or whatever. And I just think, yeah, that woman is likely internalized the same white supremacist kind of anti-Black things that are pervasive in our country. And, folks can internalize. We all are in a stew of it. We all have to kind of unlearn those things. So, I say that to say I think having a black physician, if you can, is great, but making sure that the person on an individual level really does connect with you and does make you feel like a human. I'll shout out my boy Byron Jasper. He runs the Bija Clinic in Baton Rouge. And just the way he talks about his relationship to his patients and being there constantly for his patients is just a beautiful practice. And that's the kind of doc you want. You want somebody who's really kind of connected to care about you. I talk about bringing this love back to medicine, right? Seeing the person as a whole human being. And so that's what you want. And I think I tell my family, when you go to the doctor, you should understand your diagnoses. You should be able to like recite it back. What are the symptoms? Why are you saying I have this diagnosis? You should be able to understand the medications. What are the benefits? What are the side effects? And what are the ways in which I need to take this medication? Like if I skip it every day, is that okay? Like you should really, yeah, and I tell my family, bring a notepad. I want you to have notes, right? Like study this like you went to class. You know what I'm saying? And so I think Black folks deserve that, man. We really do. The systems have not been kind to us, and I think it is that serious. It is serious enough to like this doctor's got to put in his work. Like I need you to print me something out, write it down. I need to understand it. Like we quiz me on it. Like that I know this diagnosis and I understand why you're doing these procedures and what the options are, what the alternatives are. It is really that serious. So that's something I'm really passionate about. So I appreciate that question.
And Byron, to piggyback on what you said, communication is something that they try to teach in medical school. And this is one of those things where it's really not that difficult, right? But when you will know when you've got it right, when patients take ownership of you and they're like, that's my doctor, kind of like how when they go to church, that's my preacher. When they are starting to call you my doctor, and then they're getting in on FaceTime when you're there, when somebody else is one of their relatives and they're like, I'm in here with him right now. And they're like, hey, McGee. I mean, you really feel like you're doing what you're supposed to be doing.
Yeah, and I got an example of this. Sometimes I do locums down in Albany, Georgia. Although I live in Atlanta, and Albany is a uh, probably 80% Black and brown people, right? City, but it has a massive um, hospital system called Phoebe, uh, uh, and and that take care of those patients. And every time I go down there, I mean, inevitably, the patients are like, "Don't you want to come move down here? Because right? Don't you want to stay?" And then and they'll be like, "Because Dr. Martin needs help. We need you." I'm like, and I'm just like, you can't be all things. And I think that goes into, right, to segue right what Xavier's doing with this medical school, that because there is just not enough of us, right? And what the more we can produce, the better. And they were being able to do their part. So, uh, it's a lot of work to be done for sure.
Yeah, thank you for that. These are all wonderful examples and just a wonderful topic. And I don't know if the question asker meant to ask get all that much detail, but that there was a lot of layers to that question. And then another question has popped up. So last month, in our Alumni Thought Leadership series, there was a talk on menopause as it relates to women. But the question now comes up, why do we hear so little about andropause or testosterone deficiency as it relates to men? And I think that's a really good question. And interestingly, it's probably taken a celebrity to get menopause really back on the record. I don't know if everyone knows this, but Halle Berry has taken on menopause as her sort of medical cause and put a lot of resources to that. But I don't see a Halle Berry equivalent talking about testosterone deficiency in men. So maybe from our various perspectives, why don't we talk about that so much, number one? And then maybe what are some of the signs and symptoms men should be looking out for as they age?
Well, I see those young men are a little slow to answer this, so I guess I'll be one of the older ones jumping in on this. I call it menopause. We got menopause and then we got menopause. Man, you've got so many low T clinics. I feel like the market's oversaturated. I mean, I understand no one is out there being the flag bearer, kind of like Halle Berry, as far as a male equivalent. But I mean, you've got so many different places you can go. I mean, you can even go online and visit with someone and talk about your low androgen levels. I think it's kind of what we've all talked about, and I think it goes back to stigma, just not wanting to admit that maybe things are not quite the way that they used to be. Um,
All right, now you said things, so let's, we're amongst friends here.
you,
When you say things, what things are we talking about here?
well, one of the first things, impotence. So when you get to a point to where your blood pressure or blood sugar is so far out of control that it starts to affect the smaller vessels that our small vessel plumber was talking about earlier, then that male part may not work as well. And it was always amazing to me when I was doing my clinicals at the VA, the patients were more interested in getting their Viagra or Cialis than trying to get their medicines for their diabetes. I mean, they were just like, look, doc, I'll work on my A1C, but I got to get my monthly allotment, blah, blah, blah. And so it's all about priorities. And I really think that if we prioritize making sure that men understand that working on those levels is not like gonna make you be less of a man. It's not going to demasculate you. I think it would really, really help. But oof, we got some ways to go with messaging on that one.
Yeah, we one of the hats I wear here in Atlanta is I'm the kind of current president of the Atlanta Medical Association, which is the local chapter of the NMA here, and we actually had a talk on this a few months back as one of our meetings, and we had a expert who had their own clinic, and I think Dr. McGee is correct. I think there's actually a lot of clinics that does service this because it goes in line with all these weight loss clinics and stuff like that. But you just see more women, and I don't know if it's because of Holly Berry or not, but you just see more women willing to address those issues than men. And probably, Dr. Young can speak to why. But what she informed us whether it's just that there are so many misnomers to hormone replacement therapy, and she kind of broke down how all the studies that we learned about in medical school and how how it was erroneously extrapolated, and if you went back and really teased out, you would see the nuances of those studies. And at talking to her afterwards, she basically said that there's no reason why you can't feel like you're 20 again. It's how she made it seem, right? She that and felt that if you were appropriately diagnosed and treated, that you could feel how you were in your younger years. Maybe not how you were running through the yard, but at Xavier, but you know, uh, close to it, I guess. So.
Yeah, I think I don't know that I have too much to add. I will say there's a really good book that I recommend folks check out. There's a doctor named Peter Attia who has a book called Outlive, and he talks about not enhancing necessarily your lifespan, but enhancing your health span. So kind of what are the things you could do as you age to like protect you from what he calls like the four horsemen, which I think are like metabolic disease, diabetes, cancer, and neurodegenerative diseases. But he talks about how these things are very intimately connected, and how one of the things he talks about is like the importance of strength training as you age. So strength training can become super important, and we know that as you age, particularly for men, your testosterone levels drop, and also your muscle mass and your strength drop. So one of the ways you could kind of help protect against that at least somewhat is to really get serious about strength training. I mean, it doesn't have to be like crazy weights, but like full body. You could literally go on Peloton or YouTube, full 20-minute full body strength, whatever, and do those things 4 to 5 times a week, 20 minutes, 30 minutes. And it would really make a world of a difference for a lot of us. The drop off of your muscle mass after you hit like I think 50 is really quick if you don't like really kind of stay on top of it, and that's for women and men. But I think part of the testosterone drop and that kind of thing is from the loss of the muscle mass. And so yeah, that the great book Outlive, Peter Attia, definitely check it out. And it has stuff around every holistic, that kind of holistic thing, so not just the physical health but the mental health stuff as well, and what the things you can do to help reduce the chances of getting those four horsemen that I mentioned. So that's what I could add to it.
That's actually a great segue into the next question here because you just mentioned strength training, right? That is a very important thing as people age. The age-related muscle loss that we all experience is called sarcopenia, has a medical term, and it is real. And so this is why something, we may joke a little bit, "Oh, I'm getting old, I can't recover from this as quickly as I used to." That's actually a real thing because if we aren't taking those steps to keep muscle mass, we will lose muscle mass. And that can lead to deconditioning after some really simple things. You kind of I blow up my back, or I, twisted my ankle, or whatever it may be, and having those moments to recovery. So with that, maybe from each of your specialties here, because we do have a wide range of specialties, excuse me, represented. What are some simple everyday strategies that men can adopt now to protect their long-term health?
Well, I definitely think reading, continuing to read, that is one thing. I mean, that's one thing that I've continued to do it and I've done it. I feel like I'm reading more post training than I did while I was in training. And I feel like it really helps keep my mind fresh. And, I mean, half times it's not even medical literature, right? And I mean, it's just an escape from things. Reading is something that people can do on a daily basis, and I think it will enrich you in so many different ways. Other than that, I mean, physical things, walking. Everyone can walk unless you have limb issues like Dr. Njoku's having to deal with. Um, and this is just something that's basic. Ride a bike, walk around your neighborhood. You really try to think of things that are within each person's means. And I don't think any of those are outside of everyone's means.
Yeah, I would say that Dr. McGee spoke about some important ones. That to add to that, I would just say the importance of stretching, right? I think people really underestimate how, especially if you've been out of the game. As far as my son asked me the other day, he said, "Daddy, how much have you bench pressed the most now that you're outside of your prime?" I said, "What do you mean I'm outside of my prime?" That and so but he's getting to that age where he wants to work out more. I see his testosterone starting to kick up, and but he was asking me the other day. He said, the back of my leg is hurting, right?" And I said, "Oh, because you're not stretching." Right. And I was like, "That's your hamstring, son, and you need to stretch." But I know you want to bulk up, but the importance of just stretching, that's probably more important long term, right? There's studies that show that if you can keep your weight under a certain control, flexibility, and diet, you have just like how Dr. Young was speaking about your health span, you can live a very fulfilled life, right? Long term, well past your 70s, 80s, 90s, and right, you have certain communities that um, live into their hundreds, living, right, and working all your muscles, including reading your brain and all that. But in addition to that, diet, flexibility, stretching, I would add to that.
Yeah, I could add a few things, and those were all great points. What is it? So one from reading this book, another thing he mentioned, he said one of the most powerful components of your health span is something called VO2 max, and this is kind of like your
Mhm.
business. You're like kind of conditioning, your aerobic conditioning, right? And so he was talking about how like the slow, steady build up to improve. So kind of what Dr. McGee was talking about, just getting out and getting active, and hopefully the more you can build up, right? So you start with the walk, and then maybe after a while you get to a jog, and then maybe now you can run, or even if a jog is the best you could do, whatever you can do, the better you can improve your kind of conditioning in that way. He was basically saying that VO2 max is like the most primary indicator of like your how much longer you're gonna live. He was like, even above all the other things like smoking and how you eat or whatever. And some of that is because you can't have a good VO2 max if you don't eat well enough, or if you're smoking, you probably won't have a good VO2 max. But the most important kind of predictor for like how long you'll live is this VO2 max thing he mentioned. So that's one of the things. So just getting active, kind of support what Dr. McGee said. Another thing I'll say is for mental health, there's some data that supports that, and this also kind of connects with Dr. McGee, this notion of reading, but keeping the mind sharp. There's some data that supports not just doing like intellectual things, but things that are like challenging and like new. So like Sudoku is cool, but like learning how to play an instrument, learning how to a new language, like learning things that are like make the new crinkles in your brain are one of those ways that really help kind of keep you sharp. And so reading can definitely help those things too. But the really kind of challenging yourself mentally to like learn new stuff, learning new, traveling and learning new things about parts of the world, new languages, new cuisines, like new learning new things constantly is one of those good things. I recently, because of that data, started. I'm taking piano lessons. I'm also taking singing lessons just because I want to be a neo soul superstar. I haven't given up on that dream. And I'm gonna take drum lessons. So I'm gonna just keep learning instruments. Like if I master one, and it'll probably take me a long time to master the piano, so I'll be constant learning. But I'm gonna do the drums next. And yeah, just keep finding new stuff to learn and explore. I always say there's that slither of what you know, and there's a slither of what you know you don't know. Like astrophysics is a thing, but might not know too much about it. But then there's all this stuff that you don't even know you don't know. And so I think exploring more of that, being more curious in the world, I think is a really powerful thing to keep you not only keep you sharp, but also just make life kind of more flavorful. I think that's a beautiful thing. So
One other thing I would add is uh, there's a book called Vegetation Over Medication by Dr. Bobby Price that speaks about how he kind of researched a lot of those communities that live well into their hundreds and live a very good quality of life. And so with that, he has this detox system that he does, and I think people don't speak about detox as much as they probably should. Every now and then you want to clean out the system. Obviously, if you have certain comorbidities, you want to make sure you um, speak with your doctor before, because some of them can be a little intense. But um, fasting is an important. I think it is an important thing to have in your regimen as well.
Thank you all for that. So now we're down to just a couple of minutes left before we'll have to end this, unfortunately. And I think we could go on for many hours. If maybe we could go around the room and in the last, maybe give each maybe 30 seconds, what's one final thought you want the audience to leave with here today? Dr. McGee.
So, just basically being an advocate for your health. Don't be afraid to ask questions. Um, Hopefully in the future, I know I wish we had universal health care, but at the very least, push for universal cancer screenings. I think we could all rally behind anything preventive that's going to help us not lose people. Because I lost my cousin Mike, only 6 months older than me last year, to colon cancer. So, Chadwick, I understand. There we go.
Dr. Njoku.
Yes, yeah, I think that I'd be remiss if I didn't speak about, as a vascular surgeon, just how important cardiovascular health is, right, in our community. Is some of our uh, things that just unfortunately, unless you take a very proactive view of going to your physician and taking care of yourself, that it sometimes shows up too late. And just be an advocate for yourself, for your family members. Don't always take the first notion that someone tells you. Just because they have certain degrees behind their name doesn't mean that they have your best interests at heart. And that would kind of be my 2 cents.
Thank you. And Dr. Young.
One of my things I'm really like I'm on like I have like a theme of the year, and my theme of the year this year is self-love. Love on yourself, treat yourself nice, be kind to yourself. I think so many of my colleagues are so mean to themselves and so hypercritical. I always think you have those friends that are really hypercritical about everybody, but imagine what they're doing to themselves. I think about that. So like be kind to yourself, be compassionate for yourself. Really working on that self-love and working on that self-compassion is one of the most powerful kind of medicines you could have, because it reduces the cortisol, it reduces the stress, it reduces the strain, and you're just kind of taking life a little easier, kind of being kind to yourself. I think about that old folks wisdom of like that kind, you should have an unconditional love of yourself, right? So even when you have places where you need to work on and things you need to do better, you're still worthy of love. I think about my grandma who, had a lot of grandkids, and some of us were like, quote unquote super successful, and some of us had some struggles, but my grandma loved on us all 100%. There was no, you all got loved on very deeply by my grandma. Shout out to my grandma Lillian, say your name. But yeah, man, I really think we got to really work on that self-love thing, because I think if we loved ourselves better and were more compassionate with ourselves better, we would be better in the world. We would be more loving, compassionate, kind of outwardly. And so I really think that's a message I really want to put. And asking, what does love look like in action? Love isn't just a feeling; it's an action. So like, is the way that I'm treating myself, is the way that I'm thinking about myself loving? Is this you think about my level? Like if I have children or if I have a sibling, if they thought this way about themselves, what would I tell them? How would I want them to reframe that? So thinking that constantly, what does love look like in action? And picking someone maybe outside of yourself that you really do love and care about, and thinking like, would I want them to do this thing? Would I want them to think this way about themselves? And if not, then that's not what love looks like in action. Let me reframe it in the way that I would want for them to be thinking or behaving. So that's my little piece on it.
All right, so let me make sure I answer my wife's question. 'Cause I got to go home, right? Right. But my advice for future doctors, right, if they do see this here, who being enrolled at Xavier, is be yourself. It's a long road, but just put one foot in the other. Be present. Enjoy the journey. And don't lose yourself in the midst. Don't pick a specialty just because you're gonna make more money. Pick it because it fits you and you love taking care of those particular patients. So that would be my advice for those.
Thank you. And Dr. McGee, Dr. Njoku, Dr. Young, this has been just an absolutely wonderful hour. I think our audience can already see we could go on for many, many hours more, but today our time is 1 hour, and we will stick to that and keep our alumni relations happy today, and maybe even give the audience a reason to want to come back to the next Alumni Thought Leadership Series. If there was ever any question, I don't think Xavier Wright's ever had this question, but there was ever any question for the importance of HBCUs and specifically the importance of Xavier University of Louisiana, we just showed it right here. The expertise in this virtual room today is off the charts, and I'm grateful to each of you for being willing to participate, and thankful for Xavier for supporting our alumni in this event. Dimitri, I'll turn it back over to you as we close.
Thank you. Thank you so much. And yes, thank you for answering Andre's question, because I was going to toss that to you all anyway,
Right.
because this was just an outstanding conversation. And as you said, as we are on the helm of whatever Exocom is going to look like, that future Xavier doctor is already here on this campus, and they need to hear from you. So I want to thank you for that. I want to give Kimberly Reese and Marcia Pecco an opportunity, if you would like to say something in closing before we sign off for this evening. We always have to have our AVP Kimberly Reese give her an opportunity to say something.
Well, I will just say this was amazing. I just text someone, a group of friends were like, Xavier men are amazing. And so I'm just so happy to know you all and know that I can call you for advice. My favorite boutique doctor, Trevon Thompson, did a fabulous job tonight. I called Trevon for everything. So I thank you to all of you all. Byron, I want to say that we all do need to really learn to love ourselves more. And so we need to figure out a way how you can let our students know the message, right? And so the mental health, Dr. McGee, Dr. Njoku, just thank you all for so much for being awesome doctors and awesome Xavierites. Thanks.
Yeah, thank you so much. Marcia?
No, I don't have too much more to say after that, except my first thought was, oh my gosh, we really have to recreate something like this for the students, as when they return to campus. So please be open-minded about that. Ditto what Dimitri said, ditto what Kim said, and just being here to really listen intently and even have words to provide to somebody in a judgment-free way, an encouraging way. So this was just amazing. And it was nice to see you all, even if it's on Zoom.
Well, once
Can I
again,
make a plug quickly? So I know the med school is coming about. Please make sure that you connect with QV, with Covadis in the pre-med office. She should be a major part of this medical school. I don't know if you guys already have. Last I talked, maybe that hadn't happened. So shout out to QV, and please make sure she's a part of this thing. She's a wonderful fountain of knowledge, as is the whole pre-med department. They big part of how we all got here. So.
absolutely, absolutely. Well, I want to thank you all again. And for those who are alumni who are on, who are friends of Xavier, you Foxes that are on tonight, we want to thank you all for signing in and for participating, being a part of our Alumni Thought Leadership Series. As I said, our goal is to do this on a regular basis so that we can amplify the expertise within our community, because there's a Xavier expert for just about everything out there. And we know that, but we want the world to know that as well. So this session was recorded. We're still trying to figure out internally, well, how do we want to share these messages and where is going to be the best place to house some of this content, because the content is rich, because we have such vast knowledge within our community. And you gentlemen, I will say you like knock this thing out the park. So thank you so much for this evening. And for that, we're signing off. Good night, everybody.
Good night, everyone.